So we're always going to identify our patient by agency protocol. We are also going to follow state and federal regulations. We are going to abide by standard procedures or standard precautions, make sure that we're wearing gloves, hand hygiene. We are going to ensure patient safety and privacy, as well as promote good body mechanics. Okay, for insertion of the nasopharyngeal airway, we are going to first explain to our patient what we're going to be doing. We are going to also place our patient in either supine or semi-Fowler's position. We are also going to be assessing for nasal patency. We're going to also be looking, this slide doesn't work, we're going to be looking for deviated septum. We're going to be measuring airway, so we are going to be measuring from the tip of the nose to the earlobe, adding an additional 1 inch. And then the airway should be slightly smaller than the nares. To be lubing the end or the tip of it with water-soluble lubricant. We are going to have the patient hyperextend their neck. And then we are going to insert until we meet resistance, and then we are going to go ahead and turn it until this reaches the outside, right outside of their nostril. We are going to assess, making sure proper placement. So we're going to use our tongue depressor and our pen light, and we're going to make sure that the tube is placed back. We're going to be inspecting the pharynx for the tube tip. So if the patient cough, gags, or has laryngeal spasms, we are going to assume that the tubing is too long, and then we are going to reassess the tubing and maybe go with a different measurement. When we are done, we are going to be listening to bilateral lung sounds. Also going to be assessing that there is proper air exchange. If the patient gags, coughs, we also make sure that we have a suctioning available next to the bedside. Also going to be taking this out every 8 hours. We're going to be assessing the nasal mucosa. We are also going to make sure that we are alternating nostrils to prevent any kind of ulcerations.